I've interviewed over 50 healthcare product manager candidates in the last 5 years. Today I'm sharing 7 questions I ask in every interview, and more importantly, how to answer them in a way that actually gets you hired. Hey, I'm Jennifer Rist. I'm a senior global platform leader in a leading healthcare tech company. I've been on both sides of the product management interview table as a candidate and as a hiring manager. And here's what I have learned. Most candidates blow interviews not because they lack skills, but because they don't know what the hiring manager is actually looking for. So today, I'm pulling back the curtain. I'm giving you the exact questions I ask, what I'm listening for in your answers, and what makes me think, yes, hell yes, hire this person versus a pass. This is based on real interviews I've conducted for healthcare product management roles. And if you're preparing for a healthcare product management interview right now, take notes because these questions will come up. So let's go. Before we jump into these questions, quick context here. Healthcare product management interviews typically have 3 parts. You have part number 1, which are the behavioral questions. Tell me about a time you did X, Y, or Z, right? Part 2 is product thinking, case studies. How would you approach X, Y, or Z problem? And part number 3 is domain knowledge. What do you know about healthcare tech? Today we're focusing specifically on part number 1, behavioral questions. These are the questions where most candidates stumble because it's not enough to just answer the question. You need to show product thinking, especially in the healthcare context, and results. I'm going to give you 7 questions, and for each one, I'll tell you why I'm asking it, what I'm listening for, a good answer framework, what makes someone stand out. So let's start with question number 1. Question number 1 is, why do you want to be a product manager in healthcare specifically? This is usually one of the first questions. And it sounds simple, but most people mess this up. What I'm listening for is I want to hear that you understand healthcare is different, not just I want to help people. That is so generic. I want to know, do you understand the complexity, regulatory, clinical, stakeholder dynamics? Are you motivated by the mission or just chasing a job? I want someone who has passion in the belly. Have you done your homework on healthcare tech? Are you involved in it today? Are you someone that is interested in it, and why? A bad answer is, I want to work for healthcare because I'm passionate about helping people and I think healthcare needs better technology. That's great, but it's vague. Every candidate says this. Let's look at some good answer frameworks. Use this structure. First, your personal connection, if you have one, to healthcare. Secondly is healthcare-specific insight. Show that you understand the domain. And third, why product management specifically, not just healthcare? So an example answer could be, I want to be a healthcare product manager because I've seen firsthand how poorly designed systems affect patient care. My sister is a nurse, and she told me stories about electronic health record systems that add hours to her workday and pull her away from patients. As a product manager, I can be the bridge between clinical needs and technical solutions. I'm drawn to the complexity of balancing patient safety, regulatory requirements, provider workflows, and business constraints. That's a puzzle I want to solve. And I've spent the last 6 months learning about healthcare tech, studying different requirements, researching different interoperability challenges, and talking to clinicians about their pain points. I know the space is hard, but it's exactly why I want to be here. Boom. Personal story makes it memorable. Number 2, it shows you understand healthcare complexity. Third is it demonstrates you've done research. And it connects mission to skill set. I can be the bridge. That's what gets my attention. Question number 2, tell me about a time that you had to manage stakeholders with competing priorities. How did you handle it? This is a critical area in healthcare product management. You are going to have clinicians who want feature A, maybe other clinicians like a doctor or a nurse who wants feature B, administrators worried about the cost, IT concerned about security, and executives asking, why is this taking so long? Welcome to healthcare. You're wearing many hats in this role. What I'm listening for is, can you navigate complexity without alienating people? Do you make decisions based on data and user impact, or do you just build for whoever yells the loudest? And do you communicate well across different audiences? A bad answer here would be, I had a stakeholder who wanted a feature that wasn't on the roadmap. I explained our priorities and said we couldn't do it. They were upset, but I stuck to my decision. Okay, you held your ground, but you didn't solve the problem. You just said no. A good answer could be using the STAR method. Once again, situation, task, action, result. The situation here is set the context. The task is, what was the challenge? The action is, what did you specifically do? And the result is, what was the outcome? So an example answer could be here, the situation at my previous company, I was managing a patient portal redesign. We had two key stakeholders. The CMO wanted the portal to prioritize clinical messaging, and the CFO wanted it to focus on billing and payments. Both were valid, but we couldn't optimize for both in our first release. The task here is, my challenge was to align them without making either of them feel like they lost. The action here was, I scheduled a joint meeting and walked them through the user research data. We surveyed 500 patients, and 78% said their top frustration was finding information, not messaging or payment specifically. The real problem was poor navigation. I proposed we redesign the information architecture first, which would make both messaging and billing easier to find. This became the foundation for future features in our work. And the result was that both stakeholders agreed. We launched a new navigation structure, and within 30 days, user satisfaction scores increased by 35%. And we had a clear roadmap for adding their specific features in phases 2 and 3. Why this works is it shows that you don't just pick sides. You find third options. You use data to depersonalize the debate, because it's not personal. Collaborative approach was used here, a joint meeting. You quantify the results. Satisfaction increased, right? And you had forward-looking strategy of roadmap to future features. This tells me this person can handle healthcare stakeholders' complexity completely. Question number 3. Tell me about a product decision that didn't go as planned. What happened and what did you learn? We all fail. No matter how experienced you are, things go wrong. I ask this in every interview because healthcare product management is full of failure. Features flop, launches get delayed, stakeholders reject your ideas. I want to know, can you fail, can you learn and move forward? Or do you make excuses? What I'm listening for is, do you take ownership or do you blame others? What did you actually learn? And did you change your approach based on the failure? Failure is just information. It's learning. But a bad answer here would be, we launched this feature that didn't get adopted. It was because sales didn't promote it properly and the users didn't understand it. If we'd had better marketing, it would have worked. You just blamed sales, marketing, and the users. To me, that's a red flag because you're just blaming people. You're not taking accountability. A good framework would be that you own the failure. You're not blaming others. You explain what you learned specifically. What were the gaps? And you show how you changed your approach. An example answer could be, early in my product management career, I led development of an analytics dashboard for clinicians. I was so focused on making it powerful, having lots of data, lots of filters, lots of customization. We launched it, Crickets. Adoption was under 10%. We've all been there. Maybe saying something like, I did a post-launch interview and realized my mistake. Clinicians don't have time to learn complex tools. They need simple, actionable insights in or under maybe 30 seconds. And I built what I thought was impressive, not what they needed. And what I learned was always designed for the user in the actual context, not the ideal context, and validate early. I should have tested prototypes with clinicians before investing 6 months of engineering time. Bam. Now every feature I build, it goes through testing before development. And I ask one key question. Can someone use this successfully in under 60 seconds? And if not, we simplify. That failure made me a better PM. We've all been there. If you could tell that kind of story, that's what someone like me is looking for when somebody is being interviewed. Because I want to know where they've been. Because no matter how experienced you are, we all have failures. We all have stuff that happens. And sometimes it's not our fault, but it's how we handle it. And why this works is it shows full ownership. It tells about a specific lesson. It's a behavior change, and it's humble but confident. I want product managers who fail fast. They learn and they iterate. This answer shows that. If you fall on your face, you need to be able to get up and to go, because it doesn't stop there. Question number 4 is, how do you prioritize features when you have limited engineering resources and multiple competing requests? This is the story of my life. It's probably the story of most healthcare product managers' lives. This is the core of PM work. You can't build everything. So how do you decide? What I'm listening for in an interview is, do you have a framework or do you just wing it? Do you prioritize based on data or based on who asks the loudest? And do you understand healthcare-specific prioritization factors? If not, you need to learn them. So a bad answer here would be, I prioritize based on what will have the biggest impact on users and the business. Okay, but how do you determine impact? That is too vague. A good answer could be, name a specific framework, then show how you apply it in healthcare context. An example here could be, I used the modified RICE framework, Reach, Impact, Confidence, Effort, but adapted it for healthcare. Here's how I score features. Reach, how many users or patients will this affect? Clinical impact, will this improve patient outcomes or provider workflows? Business value, will this drive revenue, retention, or strategic differentiation? Does this require FDA approval or adding compliance complexity? Is there regulatory risk here? And E is effort. How much engineering time and resources does it require? I score each feature on a 1 to 10 scale, then calculate a priority score, but I don't just follow the math blindly. I also consider strategic timing. For example, if a feature enables a major partnership, it might jump to the top even if the score is lower. And I always validate my prioritization decisions with stakeholders. I share my frameworks transparently so they understand why we're building A before B. We had 3 features coming in Q2. One scored higher than my framework, but after taking time to work with our sales team and our customers, I learned the second feature was blocking 3 major deals. Things like that. Those are the types of stories you want to tell. Why this works is it named a specific framework, RICE. It adapted it for healthcare. It showed nuance. It was a real example with business outcome. It showed collaborative effort. It validates and mentions stakeholders. This tells me this person thinks strategically and makes data-driven decisions. Question number 5 is, you don't need to be an engineer, but you need to work with engineers. Tell me about a time that you had to make a technical trade-off. This one's tough, especially if you don't have technical experience, right? Healthcare product management requires technical credibility, so you need to learn something. You don't need to be an expert. You're working with engineers. You're making architecture decisions. You're evaluating feasibility. What I'm listening for is, do you understand technical concepts? enough to have informed conversations? Can you make trade-offs between technical debt and feature velocity? Do you respect engineering, or do you treat them like order takers? That's the most important part, because I'm not for that. Engineering is working really hard. They're the big reason why you're successful or you're not, and you need to have a lot of respect for them. A bad answer here is the engineering team said the feature would take 6 months. I pushed them to do it in 3, and we shipped it on time. You just told me that you don't respect engineering estimates, and that's a big red flag for me. Good answers have a framework, and it shows you understand technical constraints and can make informed trade-offs. And so an example answer could be, we were building a feature that required integrating with multiple EHRs. Our lead engineer proposed we build custom integrations for each one, which would take 4 months and be very fragile. I asked, is there a standard-based approach? He mentioned different types of software technology, which are becoming the healthcare interoperability standard. I did research on those, on the adoption rates, and learned that while not every hospital has it yet, it may be the future of where we're going. So I proposed, let's build a certain technology first, and for legacy systems, we'll offer lightweight data export options instead of full integration. This cut our timeline in from 4 months, maybe to 6 weeks, as it positioned us for future interoperability. And the engineer appreciated that I didn't push for faster. I understood the technical landscape and helped find a smarter approach. So working with engineering, you need to work hand in hand, and you need to make them your best friends, because together you need to decide together, because they're the ones building it. Don't work in a vacuum. This shows technical understanding. This shows collaborative and engineering. It shows strategic thinking and results oriented. I need PMs who can speak tech, but stay focused on outcomes. The answer shows that. And it also shows that you respect your team. Question number 6 is, what do you know about maybe a specific healthcare product, regulations, security measures, interoperability, clinical workflows? I asked to see if you've done your homework. You don't need to be an expert, but you need to show that you understand healthcare is different. What I'm listening for is, have you studied the domain? Do you understand the unique constraints of healthcare? Can you speak intelligently about healthcare challenges? A bad answer here is, I know HIPAA, it's all about privacy and patient data. That's Wikipedia level knowledge, not enough. A good answer framework here is show depth beyond surface level understanding. An example could be, if you're talking about HIPAA, for instance, HIPAA governs how patient health information is stored, how it's transmitted and accessed. For product managers, this means every feature we build has to consider data encryption, access controls, audit trails, business associate agreements, all of those things, right? These things are pretty easy that you can find standard on the internet to make yourself sound knowledgeable, right? So use those type of stories. Really, dig in a little bit deeper. We have AI today, so there's no excuse why you can't find the information on some of these areas that can make you sound more intelligent and to give you the skills and the information that you need. And why this works is you're providing specific details. Your product management implications, not just academic knowledge, like how would a product manager use this? You're showing ongoing learning and risk awareness, right? Some alternative topics that you may need to be ready for, and it all depends on the company, right? You're going to want to know the company products, what they're focused on. Are they, in products that have a lot of regulatory clearance, 510Ks? Are they involved with interoperability, EHR systems, clinical workflows? So really understand the company so that you can be ready for these questions. If you can't speak to these, at least at a basic level, you're not ready for a healthcare product management interview. And our final question, number 7, is why should we hire you for this role? This is your closing pitch. Don't waste it. This is your time to shine. What I'm listening for is, do you connect your experience to our specific needs? Are you confident without being arrogant? And do you show enthusiasm for the role? Do you have passion, or is this just going to be another job? because I don't need a product manager that just is looking for a paycheck. A bad answer here is I'm a hard worker, I'm passionate about product management, and I think I'd be a great fit. Generic, and it could apply to any job. A good answer framework would include acknowledgement of what I need, what I'm hiring for. Connect your experience directly to that need and add a unique differentiator. So an example answer could be, you're looking for someone who could lead product development for your, like an EHR analyst platform. Someone who can manage clinical stakeholders and drive adoption in a competitive market. Here's why I'm the right fit. Need to say that. First and foremost, I have direct experience managing healthcare analytics products, blah, 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 blah. You could talk a little bit about what you did at your company. Number 2 is I've successfully managed clinical stakeholders. I've learned how to speak their language, understand their workflows, and build products that they actually want to use. Third, I have a track record of driving adoption. My last product launch achieved 85% user adoption within 90 days because I focused obsessively on user onboarding and change management, not just building features. And here's my differentiator. I'm not just a product manager who understands healthcare. I'm a product manager who's passionate about solving the messy, complex problems that healthcare throws at you. On and on and on. I could go on and on and on. But that is the approach. And why it works is it directly addresses the hiring manager's needs. It provides specific evidence, why you're the one. It shows understanding of healthcare challenges. And it's confident but humble. I'd love to be part of your team. Saying something like that in the end. This is how you close an interview strong. That's the 7 questions. Now let me wrap this up. Okay, quick bonus tips before we wrap up. Tip number 1 is prepare stories in advance. Don't just wing it. Have 5 to 7 STAR method stories ready that show stakeholder management, data-driven decisions, product thinking, failure and learning, technical collaboration, maybe healthcare domain understanding. Write them down, practice them. You'll use them in every interview. Tip number 2 is ask great questions at the end. When they ask, do you have questions for us? Don't just ask about the team or the tech stack. Ask strategic questions like, what's the biggest product challenge you're facing right now? How do you measure success in this role after 90 days? What does the ideal product management look like for your team? This shows that you're thinking like a product manager already and that you're serious about being successful in the role. Tip number 3 is send a follow-up email. I know a lot of people don't do this anymore, but I grew up in this. This was like the thing that you definitely did no matter what, and it still holds true because people appreciate this. Within 24 hours, send a thoughtful follow-up that thanks them for their time, references something specific from the conversation, and reinforces why you're excited about the role. Most candidates don't do this anymore, but stand out. All right, that's it. If you're prepping for a healthcare product management interview right now, I hope this helped. These are the questions that I ask, and they're the answers I want to hear. And what makes someone stand out? But here's the reality. Preparing for interviews is hard. You need to practice. You need to get feedback, and you need to refine your stories. If you want help with that, I offer interview prep coaching. We'll do mock interviews, review some answers, and make sure that you're ready. If you're interested in that, there's a link in the description below if you're interested. But also follow me here. If you're not ready for coaching yet, that is fine. Subscribe to this channel. I'm posting free videos and free content every week, mostly on Tuesdays and Thursdays, on healthcare product management careers, resume tips, and everything that you need to break into or advance in healthcare product management. Good luck with your interviews. You've got this. I'm Jennifer Rist, and I'll see you on the next video.